This video will be part 3 of my coverage of Chapter 9, Lifespan Sexuality, for PSY 345, Human Sexual Behavior. So now we're shifting to sexuality in the middle years. Often, we have varying definitions of what do we mean by middle age. Researchers tend to identify middle age in a fairly heteronormative way. So your authors make this statement of a time in a person's life that begins when the last child leaves home and continues until retirement or the death of a spouse. Well, you can see how narrowly defined that is. That's defined in terms of this normative expectation that you're going to form a relationship, you're going to have children, you're going to live a working life in a monogamous relationship, and there'll be a retirement period of time and or death of spouse. It's a fairly restrictive definition that needs to be broadened. In terms of pinning it to age, the average is kind of to identify that period of time between the mid-30s to the early to mid-50s, but that too is variable in terms of how people personally view their own middle age. Regardless of exactly where you pin that time frame, it is a time of transition, and it's a time in which we kind of start to redefine in some ways our sexual selves. The body is changing, our motivations are changing, our relationships are often in transition as well. So it is a time period where people tend to report doing some novel thinking about who they are as sexual people. There is a tendency on surveys as well as interviews for people to report a decrease in sexual interest and sex drive. They also have a tendency to report some decrease in sexual activity at age 50. At the same time, though, and this is a little bit of a paradoxical finding, we do find increased incidence of STIs and HIV over the age of 50. Now, part of what's driving this is that people 50 and over tend to see doctors more often than people who are younger, and they may have their STIs or HIV status may become known more frequently. But you also have to think about 50 and over. You may have people post-divorce, post the end of a relationship, moving back into the dating pool, attempting to find new relationships. You may have people who are now, maybe they're divorced, maybe they're not in a long-term relationship at this point, and maybe they're engaging in more casual sex. So again, that may be partially responsible for the increase in STI diagnoses because they're having more casual sex with partners that they don't know as well. When we look at the biological changes that males and females face, there are some commonalities, but there are also some differences. For women, menopause is the major biological change in the middle years. Menopause is defined in terms of the complete stoppage of having periods, and we tend to think strictly of that event. So are you in menopause? Are you finished with menopause? Well, menopause typically has an onset for women in their 40s, and there's no one marker of when it happens. Some women notice nothing perimenopausally other than inconsistency in their periods and perhaps some subtle physiological changes, but nothing big. Other women have very large changes, like having hot flashes, having difficulty sleeping, changes in their weight, changes in their metabolism that can occur with perimenopause, and those changes can be significant for them. So for some women, they experience large physiological and emotional changes. Other women experience very little in terms of physical and psychological changes. What's going on in terms of perimenopause is a gradual decline in the ability of the ovaries to produce estrogen in the same levels that were required for being reproductive. Females are born with all of the eggs that they're ever going to have, and once those are spent, then there's no need to maintain that production of estrogen. So it's a gradual decline, and as that estrogen declines, there are changes to women physiologically. And as I said before, for some women there are emotional consequences to that are directly tied to that decrease in hormone production. And for other women, the change is very, very mild. To be considered menopause, postmenopausal, that typically occurs by 50, or on the outside, mid-50s. You are considered to be fully postmenopausal if you've had no periods for 12 months or longer. And then it's considered you're done with menopause. Now, understand that for some women, they can have very erratic, sporadic periods, or modified periods, such as spotting, or some women experience, periodic bleeding very frequently, and then nothing for quite a while, and then some more, and then nothing. So it's very, very dependent on the individual and her specific physiology. For males, there is a drop in testosterone, but it varies tremendously from one individual male to the next. For some men, that can be a precipitous drop that is obvious. They have physical symptoms, may have emotional symptoms. In other men, they experience very little drop at all. So it's highly, highly variable. For some men, their testosterone level drops so far that they experience those psychological symptoms such as depression, anxiety, hot flashes, changes in libido, and also erectile dysfunction and cognitive deficits. If a doctor determines that that is the case, that their testosterone is very low, then hormone replacement therapy is certainly something that can be done. The same is true for females. You have that decline in estrogen and progesterone over the course of perimenopause, and then, postmenopause, or at the point of menopause. Some women, in consultation with their physicians, may choose to have hormone replacement if there are good reasons to do so. So for both males and females, the decision of whether or not hormone replacement is appropriate is something that needs to be determined in consultation with your physician. So this TED Talk that I'm sharing with you is from a researcher who gives specific attention to sexuality in older adults. In our culture, in American culture, we tend to have really negative attitudes and to stigmatize sexuality in older people. We are a very youth-oriented culture. We tend to presume that sex is much more, quote-unquote, normal for people when they're young, and is quite abnormal for people when they are old. So we need to give some specific attention to what does it mean to be sexual as an older adult.
So if we get back to picturing those participants who come into my lab, I want you to think about what age group immediately pops to your head when I talk about the research that I do. So I'll roughly divide our adult lifespan into 3 categories: 18 to 34, 35 to 50, and 50 plus. So with a show of hands, How many of you immediately thought of my participants as being in that 18 to 35-year-old range? Okay. How about 35 to 50? Anybody? How about 50 and over? All right, there's some representation there for the older group as well. But what we see here is that the majority of you immediately pictured my participants to be in that younger age group. Why is that? One of the anonymous reviewers I had for a grant that I once submitted perfectly wrote out and highlighted this bias that we have against sexuality in older adults. And I'm paraphrasing. They said, I can't imagine that an older adult would want to come into the lab, have their genitals filmed, and watch pornography. This just does not seem feasible. So what message was this sending to me? One, that I didn't get the grant. And two, that we have this bias in society against older adults engaging in this process of sexual expression and sexuality. That either older adults are too old to have sex, that they are too old to be interested in promoting sexual arousal and understanding of sexual arousal in their demographic, or that they're just not able to come to the lab anymore, again, presumably because of their age. What this reviewer was indicating, and the messages that we're receiving within society, those implicit messages, those conversations we have about sexuality, those popular representations of sexuality, is that our sexual lifespan is incredibly limited. So if we look at this representation of, let's say, the average human lifespan, we have a very small WTF, window to fornicate. That's what it stands for. And this very small, exclusive WTF is incredibly limited to individuals, again, that are relatively young and within this reproductive age. The more popular interpretation of WTF is the expression that I have when I look at this vast expanse of nothingness, of sexlessness that we're supposed to endure, again, according to these popular representations of sexuality, that this pleasurable window is really for a very elite group of individuals of a certain age, and the rest of us must endure decades of nothingness. I, for one, won't take it. And in fact, when I've talked to my classes about this bias against sexuality in older adults and asked, what are some of these popular representations? One that was thrown out to me was that, well, once you've had children, you don't need, which again is incredibly excluding a whole group of individuals who don't want to engage in sex for procreation. But also, as somebody who has had children, I can personally assure you that that is not the case. That sex does not end once I have been pushed out of this window. And I feel we have an obligation to push back and say that we need to expand this window across the adult lifespan. Unfortunately, what we see in those popular representations is echoed in biases that individuals have when we look at the research. So here, this was a study on individuals aged 66 to 90, in-depth interviews about whether or not these patients had had discussions about sexuality with their physicians. Have their physicians broach the topic with them? And what we see is that none of my physicians has ever talked to me about sex. They look at my white hair and they stop asking. I can't recall ever discussing sex with a doctor, I guess since my wife had a baby 45 years ago. So this message again is saying that somehow we as patients cannot talk to our health professionals openly about sex, and that we shouldn't be talking to our health professionals about sexuality. Unfortunately, when we look at research on the flip side, so when we look at physicians and their experiences, they echo a lot of these sentiments. That as physicians, the common themes that came up in research were that sex is not actively broached with, or the topic is not broached with older adults, that it is not an appropriate topic of discussion with older adults, and that it is a matter best left to the pressing needs of younger individuals. And again, not all physicians are like this, right? This is just the general consensus that's coming out of the research. What this suggests is, again, that we have a strong bias against having those open discussions with health professionals in sexuality. And this goes completely contrary to the World Health Organization definition of sexual health, which highlights that it shouldn't be just the absence of disease or infirmity or dysfunction, that rather sexual health should include those conversations about having pleasurable and safe sexual experiences, that we should have a positive approach to sexuality and sexual relationships, and that we need to really respect the sexual rights of all persons in order to be able to promote sexual health. So we have this obligation to really move forward from these biases and to have these open discussions. We should be having these open discussions. In addition to this obligation, what we see is that, in fact, the research really supports sexual satisfaction as being linked to a number of positive outcomes related to quality of life. So research spanning the different age groups has demonstrated that sexual satisfaction is linked to greater life satisfaction. It's linked to greater relationship satisfaction. It's significantly related to greater mental health, physical health, and overall happiness. Now, when we look at this, we understand that the research here is correlational, that this isn't implying causality, but this is saying that if you have higher sexual satisfaction, you're going to have higher quality of life. So it seems an obvious way to promote higher quality of life by having, again, those open discussions and promoting sexuality in older adults. And this is particularly relevant when we think about our rapidly growing population of individuals over the age of 65, the greater life expectancy of individuals as compared to our predecessors, and this idea that we need to promote active aging. So when we look at health professionals, we often talk about promoting, physical activity, exercise in older adults, healthy eating, those social connections, those cognitive challenges in order to have this holistic understanding of active aging. Yet somehow we leave out this whole conversation about sexuality when sexuality is linked to all these positive outcomes for individuals. So again, we have this bias that somehow maybe older adults are just not having sex, and there isn't a need to address this because, again, that engagement isn't there. That's completely false. So if we look at a large nationally representative study done in the States of over 3,000 individuals, age 57 to 85, what we see here is I'm giving you a snapshot of the oldest age group. So this is just 75 to 85-year-olds. We see that, yes, they are in fact still engaging in sexual activity. And although it is significantly less than younger age groups, so we see engagement in sexual activity declines significantly with age, those who are engaging in sex, more than half of them are having sex 2 to 3 times a month, 75 to 85-year-olds, and a fifth of them are having sex at least once a week or more. These rates are comparable to younger populations of individuals. So what this is telling us is that we really have to start challenging those biases, that individuals who wish to engage in sexual activity are going to continue doing so up into those 9th decade of life. I can only hope that's the dream, right? What we also need to do is start focusing more on that pleasurable approach. We need to start thinking about, okay, We know that individuals are engaging in sexual activity. We also know from this study that more than half of these individuals indicate that they have a sexual dysfunction that they find bothersome. Also, significantly increased rates of physical health conditions. So we know that despite these barriers, individuals still want to engage in sexual activity. We have to think of, what is it about sexual activity? What is it? How can we take that pleasurable, positive approach to understanding sexual expression in older adults? So researchers at the University of Ottawa, Dr. Kleinplatz and her colleagues, have looked at what constitutes great sex. They looked at individuals over the age of 60 who've been in a relationship for 25 years or more and who indicate that they are still having great sex. And what they found is a number of common themes come up in these interviews. This idea of individuals being authentic with their partners, having a connection with their partners during sexual activity, being fully present in the moment, having deep intimacy, exploration, and risk with their partners, being able to be vulnerable in that relationship and vulnerable in those sexual activities. And of course, having that extraordinary communication between partners and that sense of transcendence during sexual activity. What I find so inspiring about this particular work is that it's taking that positive approach. It's saying, okay, we know individuals are enjoying sex. Let's find out what it is that's so wonderful about it. And what gets me excited is taking this research and then bringing it into the lab and saying, okay, we have this picture of great sex. How does that relate to our physical experience? How does our physical body, so, this entity that is providing us with those sensations and that sensory information, how does that interact across the lifespan to create these experiences? So if we get back to those original questions of, can I get people to come and do research in my lab? The answer is yes. And I'm putting up this graph here, which is, here to demonstrate to us that, in fact, if we look at the different age groups, so here in purple, I have 18 to 28-year-olds, in blue, 30 to 45, and in red, I've got the 50-plus-year-olds. What I want to highlight here is that there are no differences in self-report when individuals are coming into the lab. So those 50-plus-year-olds are just as relaxed as those younger individuals when they're coming in and having sexual arousal measured. They're enjoying it to the same extent. So again, these are not significant differences. They're enjoying it to the same extent as those younger populations, and their self-reported sexual arousal is just as high as it is with those 18 to 28 and 30 to 45-year-olds. And in fact, if we ask them, I ask my participants to compare their sexual arousal to how they feel when they're with a partner. What we see is, on average, again, there are no age differences. So here we have much less sexually arousing, much more sexually arousing, and no different. There are no differences across age groups. And what this shows us is, again, we have to start pushing back against those stereotypes and biases. We have to move beyond these ideas that we have about sexuality in older adults and move forward as educators, as health professionals, as citizens, as researchers, to embrace and promote sexual health and sexual education across the adult lifespan. Because with any luck, we're all going to be there one day, and I'm hoping we're all going to enjoy that time frame that we have. Thank you.
So I think that gives you a much broader perception of how people function sexually when they are older, particularly the fact that you see people continuing to report high levels of satisfaction and high levels of intimacy and connection in their sexual experiences when they are beyond 50. So I think most of you are in your 20s, in your early 20s. It's important that you start to broaden your point of view in terms of your future as a sexual being, because I think I've said this before, probably in part 1 of this chapter, most of your life will be spent over the age of 20. And over the age of 30, there's still an awful lot of living to be done. And to assume that sexuality will not be a part of that is not particularly healthy. So as we think about sexuality in the later years, researchers do show that frequency does tend to drop somewhat, and that's often predicted by, remember that these are group statistics. The decrease tends to accelerate for people who have chronic health problems, people who are not partnered, and for people who are 70 and older, primarily connected with those two things I've already said. So people with chronic health conditions that have impacts in terms of their sexuality, and if they lose their partners and find it difficult to find new partners. For men, we do see, and this is highly variable from one person to the next, there is a decrease in penis size, and that includes the size of the erect penis. There is an increase in stimulation and arousal that's caused by touch, and a decrease in arousal through visual stimulation. And that's a change that can be taken advantage of when couples are engaging in sex. It requires that you understand that that's something that may happen and that you use it to your advantage. Erections do take longer to materialize in some cases, and they may be less rigid. Now, again, that can be a good thing, and it can be a challenging thing. Why can it be a good thing? It can be a good thing because it can coincide with the slower rate of arousal for females, if you're talking about heterosexual interactions. It can also give you more time to focus on what is often called foreplay, but it's just part of sex. It can give people more time to focus on the intimate physical arousal process rather than being so focused on intercourse, rather than being focused on orgasm. So if people are open and they think about sexuality more broadly than just in terms of orgasm as the goal, remind yourself that orgasm is really short. If you're lucky, an orgasm can last a couple of minutes. But if your sole focus in your sex experiences is about orgasm, you'll be missing out on a great deal of the joy that is sexual experience. So I argue that the fact that erections take longer to achieve, that they require more stimulation to maintain, that it takes longer to recover before you can have another erection, those aren't necessarily bad things. And in fact, when people are mindful of these changes and they've talked to their partners about them, they can actually turn that to their advantage and have even more joy in their sexual interactions. For women, and again, you can either take a positive perspective on these changes or a negative perspective on these changes. Menopause has been found to be associated with increased libido, which goes counter to the stereotype. The stereotype of menopausal women is that they are sexless. And that comes from the stereotype that once women can no longer have children, they don't serve a sexual purpose. So fighting that stereotype is the finding that many women report an increase in interest in sex, an increase in sex drive, and also a greater capacity for orgasm. Now, part of what's going on there is, post-menopause, there is no risk of pregnancy. So you're freed from one of the big anxiety-provoking concerns that women may have as a part of their sexual experience. there's also the fact that as women age, they know their bodies better. They know who they are and what they want. And once you've taken off the table the possibilities of pregnancy, there's often women in their 40s and 50s report an increased desire to have sex and increased enjoyment, particularly orgasmic enjoyment of sex post-menopause. Now, at the same time, there are consequences to decreased estrogen levels. So you can have the vaginal walls get thinner, there's less lubrication. Those are changes, physiological changes that there are ways of correcting for them. Using lubricant is an easy fix to the lubrication problem. And there are strategies, changes in position, changes in technique that can address the issue of discomfort as the vaginal wall thin. Part of what's happening in terms of increasing libido and increased initiation of sex is the fact that for postmenopausal women, their relative level of testosterone tends to increase. So that can actually factor into changes in sexual interest and sex drive. Now, for couples, if you're talking about heterosexual couples, males and females being aware of the changes in themselves and in each other can be extraordinarily valuable, so that you can continue to work toward mutual sexual satisfaction. For regardless of heterosexual orientation or non-heterosexual orientation, being aware of changes in yourself and changes in your partner is extremely important. And it's important to keep the lines of communication open so that you're aware of what your partner is experiencing, you're aware of what you're experiencing, and you're aware of the fact that your needs and interests may change over the course of your relationship. Now, I was just listening to one of the Sex and Psychology podcasts, and they were talking about this issue of sex post 50, and one of the things that the guest commented on extensively was the fact that we tend to be so orgasm focused in Western culture that we tend to miss the development of capacities to experience sexual satisfaction beyond that orgasm goal. So, for example, the guest remarked quite clearly that people will report in interviews and in surveys that sometimes the best sex they've ever had did not involve an orgasm at all. And what that points to is the fact that our sexuality and our sexual experiences is not dependent on a particular outcome. But in American culture, in a lot of Western culture, we tend to be very tethered to this idea that it's really all about, particularly, the male orgasm. So if you're talking about heterosexual sexual relationships, that overwhelming bias in the direction of focusing the sex act on just the male orgasm is incredibly limiting, and it can lead to a lot of misunderstanding and to encouraging couples to abandon having sex at all. If, for instance, physical changes mean greater difficulty with erections, greater difficulty with getting an erection and maintaining one, if that becomes the sole definition of the goal of sex, then that can mean that the couples will stop having sex entirely. Same for gay men. For women, if your assumption is that orgasm is the only and the end goal for you, for your partner, again, it's a limiting perspective, and it can take out of your possible sexual encounters things like mutual erotic massage, and a whole host of other possibilities that are equally satisfying as orgasmic sex. So that concludes my coverage of Chapter 9, Lifespan Perspective on Human Sexuality.